Right, I'm now recording. Okay, fantastic, and you can hear me okay?
Yep.
And I will let everyone in. No going back now. I'm just admitting everyone at the moment, so please just excuse me as they come in. Thank you everyone for popping yourselves onto mute. Okay. All right, I might get started. Good evening, everyone. Thank you for attending, and I'll just let 2 more people in. Okay, thank you for coming this evening or attending in your place of residence or wherever that may be. Welcome to the June update. I wish to acknowledge and pay my respects tonight to the traditional custodians of this land. I pay my respects to their elders, past, present, and future. I would also like to extend my respect and acknowledge any Aboriginal and Torres Strait Islander people that may be here tonight. I'm your host. For those of you that don't know me, my name is Alicia Brown, and I'm a Regional Services Officer in Bass Coast and South Gippsland. May I ask that you please ensure you're on speaker view so that you can see everyone, as we'd like this to be as real as we can this evening. Please ensure also, as I did say, that you are muted. If you would like to ask a question, please feel free to unmute yourself, or additionally you can pop a question into the chat and I'll monitor that as best that I can. The presentation will be made available this evening afterwards. A little bit about Gippsland PHN. Our core functions are health planning, commissioning services and practice support and system integrations. As you know, we do online event registration and we do a training and events newsletter and a link newsletter which updates you about what's going on with Gippsland. Additionally, we have Gippsland Health Pathways. Health pathways are designed for use during a consultation and provide a clear and concise guide for assessments and referrals. Just going to show you now a quick example of health pathways. Okay, as you can see from Health Pathways, I've just opened up. If you do not have access to Health Pathways, please contact us and we can give you access to Health Pathways. I've just opened this up. Down the left-hand side of the screen, you can see that we've got links to immunisation. You can also search in the top bar there on the left-hand side. So you'll see if anyone hasn't seen these before, we always have red flags or anything of note at the top of the page. And then each clinical pathway in immunisation, each clinical pathway goes through the same process of assessment, management, referral, and then information. And it links out to any other further information that might be helpful. If you discover, because you are all clinicians, if you discover that something on Health Pathways is out of date, that the link is broken, anything like that, we please encourage you to send feedback. We'd really appreciate that, because without it, we can't be monitoring every single page every single day, and it makes it a much better resource for everyone to share. Okay, so Gippsland Health Pathways. In addition to Gippsland Health Pathways, we have the Digital Health Guide. The Digital Health Guide is currently offered to all general practice and allied health professionals in Gippsland. It's a complimentary subscription to the Health Guide. What the Health Guide is a guide to mobile health apps that are available for patients or for clinicians also. I'll link out to that now and show you what it looks like. That's what the page looks like. You can search alphabetically down the left-hand side, and then you can search also in this top bar that you would see up the top here, you can search out to things like immunisation. So I'll show you what that looks like now. Can everyone see that screen? I have a nod of heads for those that can see the Digital Health Guide with immunisation. Great, thank you everyone. So on this you can see I've just typed in immunisation up here, and it's come up with any app within the Digital Health Guide that is to do with immunisation. So we've got VicVax, which is from the Royal Children's Hospital, that I've recently discovered and I'm very excited about. We've got a breastfeeding tracker, because that would mention immunisation as it does down here. And we've got the new and very exciting immunisation handbook. Now, some of you may notice down here that we've got Vax on Time that will shortly be removed. So it's things like that, just like in Health Pathways. If you see that something on there has been taken down, again, we encourage you to do the feedback. So just down the bottom left-hand side is a little contact us. The other important thing to note when you're searching for things in the Digital Health Guide is that anything that has a little icon with a page and a badge of sorts means that that has been reviewed and has journal articles references attached to it. So if you go to that, you can then click on that. It will show you the app, and then it will also show you all of those articles that are on that app that relate to it. Okay, thank you. Okay, I'd just like to share with everyone, we recently on our last practice visits, or just before our last practice visits, I should say, conducted a general practice survey. In that survey, we found of the 82 that we invited, so that's every practice across Gippsland, 37 practices responded, which was a good rate of 45% responded. We pulled out some of the responses in regards to immunisation, and we note that the National Immunisation Program schedule were provided less by 19% of practices, while 30% reported providing more. 24% of practices were not able to provide FluVax for all patients due to supply issues, which I'm sure is not a surprise to anyone. And some of these comments were extracted straight from those, so just some unfortunate comments about the way that staff were being treated by clients, and we're all certainly very empathetic in how that was within practice. We've also got here, as you can see, the amount of FluVax that were given. So orange is in 2020 and when they were given, and blue is 2019. So we can see that there was a rather phenomenal difference between those two years. The next graph will show the demographics of patients receiving flu vaccines in 2020. So in Gippsland, we used the polar system to extract this data, and we can see in 2020 in Gippsland we have already given 68,000, over 68,000, and this data was extracted on Friday, so it's pretty current, but 68,000 immunisations. So well done. I think that's a really great effort. It's amazing. So we also look at this, which shows us some influenza notifications by LGA in 2020 to date. I don't know if anyone saw the practice managers update last week, but I did also provide in that the Victorian stats for where we were for the year as well. Okay, so enough of me talking. We're all here for Michelle Wilkes, so I'll now introduce Michelle. So Michelle is the Academic Supervisor for La Trobe University Nurse Immuniser Program. She's experienced in immunisation as a registered nurse and educator, has been seen at many levels from acute care through research to primary health care. She's the co-convener of the Immunisation Special Interest Group of Public Health Association of Australia and was a member of the National Immunisation Committee that reviewed the National Vaccine Management Guidelines, Stride for 5, second edition. So we're very thankful that we've got such an expert here with us this evening. Thank you. And Michelle will now share her presentation.
Okay, let's just see how we go sharing screens. Okay, I'm going to stop yours, sorry.
Yep, that's okay.
Okay, this is a really weird feeling for me because I've been down many times to see you all face to face. So to do it on screen and only see a few faces is quite difficult. I'm more than happy for you to interrupt if you've got questions. I'd like to make this about what you want to know, not what I'm just going to talk about. So feel free. So I don't think we can start any update without talking about, except my presentation doesn't want to move on. Sorry. The elephant in the Zoom. So what has COVID-19 done for immunisation? And I think we do need to look at that because it really has made a big difference. I mean, I'm sure you're seeing it in your practices. A lot more people are after flu vaccines this year than previously. And all those people you've been chasing for years to try and get them their over 65 pneumovax have suddenly turned up in droves. We know that it's affected immunisation both at general practice and local government areas, and it's gone both ways. Some people are going to local government that have never been there before to have their immunisations because they don't want to go to general practice and catch the coronavirus, and then others have rushed from local government to their GPs because they don't want to be in that great big cattle call, as they have been calling it, and being exposed, not understanding how local government has really adapted. So I think there's been a lot of toing and froing, and you've probably seen people that you've not ever seen before. So I'm just going to get on. We've had great opportunities because we have been able to give a lot of influenza vaccines. The trouble is actually being able to access those vaccines. So that has been one of the challenges, and also pneumococcal. I'm also going to touch on the NIP changes that are coming up on the 1st of July as well. So as of the 5th of May, we've had 2 million doses of government-funded influenza vaccine distributed in Victoria, and we've actually had an extra 3 million vaccines made available for the whole of Australia. So 16.5 million influenza vaccines. Seqirus actually went back into production and produced another 3 million vaccines because they could see that this was going to be an issue. I'm not sure what distribution there is for private stock and government vaccines there. Nobody will give me those statistics, so yes. So what's it going to mean for the flu season this year? And this looks like a really busy slide, but I just want to show you a few things because honestly, to predict what's going to happen in a flu season is crystal ball stuff. So hopefully you can see my gorgeous little laser pointer that I've just worked out how to use. So I'm very excited. So back in, where are we wanting? 2009. So back in 2009, this is the flu notifications back in 2009. So here you can see that the peak of the flu season was around June, July. So that's why we used to, 15th of March was the day that we all started to give the flu vaccines. We had everybody trained. All the oldies were ringing us up at the end of February to say, okay, let's make my appointment. And we had them so well trained that they're still doing it to this day, ringing up in February, wanting to make their appointments for their flu vaccine. So that's 2009. By the time we get to 2015, which is here, 2016 here, we can see that that peak has moved. And so the peak of the flu season has moved to sort of around mid-August. So that's why we started giving the flu vaccine later in the year. We all know that the efficacy wanes after 3 to 4 months. And so to have maximum protection, we started giving the flu vaccine in mid-April, so as we got that protection over the peak time. Then in 2017, I don't know what happened, but this is the peak that we had in 2017. Massive number of influenza notifications. It was round about, excuse me, 250,000 notifications for the year, but this huge peak mid-August. So everyone geared up. 2018, I'm sure you all had your fridges overflowing with flu vaccine, everything was great. And in 2018, we had the quietest year ever for influenza notifications in Australia. So we had less than, or just on 60,000 notifications for the year as compared to 250,000 the year before. So then that brings us to last year, 2019. And that was the year that we've had the greatest number of notifications ever, with a really early start to the season. So you can see back in January, we're really starting, and with that early peak again, so that peak around June, July. So if anybody would like to absolutely hazard a guess of what's going to happen in 2020, you're a better person than I am. So back in 2019, we had around about 314,000 notifications for the year. So it really is a lot of notifications, but you know, this year we've got a lot more people that have had the vaccine. We've also got, you know, at the start of the season, we've got social distancing, we've got people washing their hands. So we are really hoping that maybe we were not going to have quite as big a season as we have had previously. So who makes all these decisions? We all know about the Australian Technical Advisory Group, ATAGI. They give us our clinical advice on influenza. And I sort of feel as though I'm giving this, you know, shutting the door after the horse is bolted, because I'm sure most of you have already given most of your flu vaccines. But just, you know, we recommend flu vaccine for all people over the age of 6 months. None of this is new. The big thing is that all children aged 6 months to less than 5 years are now eligible to have funded free annual flu vaccine on the NIP. Victoria was funding it as a state program, but now it's a national program. So everybody from 6 months to under 5 years and everyone over the age of 65 will receive free funded vaccine, influenza vaccine, and then those with special risk conditions are also available for funded vaccines as well. I like this little graph that actually the Melbourne Vaccination Education Centre, MVEC, put out. It's exactly the same as the one that's on the ATAGI clinical advice, but it gives you your sort of green for go, orange for beware, and red for please don't use this vaccine quite clearly. So, I mean, we've had a big change in the 6 months to under 3 years in that we've got new vaccines now, and we're giving 0.5 of a mil to those people. So no more 0.25 of a mil, no more half doses. They're trying to simplify things as much as possible to make life as easy as possible as we get an increasingly more complex schedule. These are the vaccines, so your Afluria Quad and your Influvac that you cannot give to your children under the age of 3 years. And of course, your Fluad Quad. So this has been a big difference, only having one quadrivalent vaccine for the over 65. So they didn't feel the need to rush off down to the pharmacy, get their quadrivalent vaccine, and then come back to general practice to actually get their highly adjuvanted doses. So I think that's really helped. DHHS put out in their newsletter, which I don't know if you have all seen or not, that there are no more doses of Fluad Quad available. They have given out 100% of the doses for the Victorian cohort aged 65 years and over. So there is no more Fluad Quad available from DHHS. If you do have people over the age of 65 that haven't had their Fluad Quad, then it is okay to give them these vaccines, these other vaccines. There's nothing wrong with it. It's just they haven't got that highly advantage of the Fluad quad. Please stop me if I'm talking too quickly or there's anything you want to ask a question about. So we all know that we need to have the influenza vaccine and we need to give it to all of these cohorts. That hasn't really changed. The one thing to make clear is for pregnant women. So pregnant women that cross 2 influenza seasons can have 2 influenza vaccines. So someone that is pregnant in their first trimester maybe, or their second trimester sort of for 2020 can have this season's influenza vaccine, and if they're still pregnant in March or April, whenever the next vaccine is available, then they can get a second dose. We're really trying to cover them for the strains that are circulating around. It's also a bit of a difference is that we've got flu vaccine that has a longer expiry date. Remember, you know, sort of like the end of Christmas, you used to just go in and throw out any vaccines that you had left over because they all expired around about the 31st of December. We now have vaccines that are available to February, which was great when people were allowed to travel because you could actually give them a flu vaccine before they travelled. But that's a thing of the past at the moment. So it will be very interesting to see what happens when travel can start again. I'm just going to have to turn off my little laser pointer because it's just, sorry, it's not letting me do anything. Okay, it's just freezing up my screen, I'm sorry. All right, so let's talk about what is happening at the moment. So this is in Victoria. So influenza-like illness is substantially below where it normally is. So we're seeing, so normally at this time of the year, depending on what year it's been, but it's an average for every 1,000 patients that come in to be seen, between 10 and 35 are usually presenting with an influenza-like illness. At the moment, we're only seeing about 4 cases per 1,000 patients, and that's just presenting with that influenza-like illness. We get this information from VicSpin, which is the Victorian Sentinel general practice sites that look at this. And this last week, or the week of the 1st of June, only 1 swab was taken for influenza, and it didn't, that actually came back as negative for influenza. So it's just showing people are not presenting to their, I don't know if it's that they're not presenting to their general practices, maybe we're sending them all off to the COVID testing places, or people are testing for COVID, but they're also, when they're testing for COVID, my understanding is a lot of the places are testing for influenza, and we're just not seeing the notifications. The cases that we are seeing, it's been influenza A, and the influenza A is mainly in the older people, the over 65. The type B we're seeing in the under 5s, but it's still, you know, not very many cases. As you can see, this notification I had from the 1st of June was Victoria had a total of 4,444. I don't know the significance of all those 4s. Maybe there's something I'm missing for the entire year. So we're really not seeing a lot, but that could all change as social isolation stops and people are not out there sort of staying at home and they're not washing their hands. Certainly in Melbourne, you know, people are starting to flock back onto public transport and things like that. So some of those things that where normally you would get that spread of influenza, we may or may not see it again. I think we've sort of probably changed people, at least for this season, is in their hand washing. I think people are just walking around with gallons of hand sanitizer and things. So maybe it will make a difference, maybe not. So our challenges are that we don't have any Fluad quad left from DHHS. So I mean, and over 1 million doses have been given out in Victoria. So if that's our cohort and there's still people waiting to be vaccinated, I'm not quite sure where it is. I do know in the PHN that I work in that there are some practices that have suddenly discovered that they really did over order and they've got too many. And so they are sharing with practices that need that. That's perfectly acceptable. Just make sure that if you are doing that you're maintaining the cold chain. So if you're going to pick up excuse me, doses from another practice or from local government or wherever, just make sure that you've followed all your cold chain guidelines to do that. Pneumovax 23, we know that there's a shortage, and there are just, people have, in my area, people have flocked in to get the Pneumovax. You know, we've got 66, 67, 68, 69-year-olds, whatever, that have never had Pneumovax before COVID came along, and they're beating down the doors. I need the pneumonia injection. And it was really, you had to make sure that people totally understood that they, by having this was not going to stop them having COVID. I don't know if you came across the same sort of thing, but yes, people were, yes, quite insistent that they needed Pneumovax 23. And of course, now we've got a schedule change as of the 1st of July, and they won't be getting it now. So unless they're medically at risk. So I will talk about that in just a moment. The other thing that COVID's brought about is, you know, the way that traditionally we've run flu clinics, and, you know, we've been able to block off an afternoon or have the nurses run clinics, and that's all had to stop. So people have been very creative in how they've run their flu clinics. And that's included, and it was all over the news, people running clinics where people sat in their cars and had their vaccinations, which then led to ATAGI needing to put out another thing about observing people after vaccination. I mean, we've always tried to observe people for 15 minutes, but during this time, ATAGI has looked at it and said, you know, we know that that's just not practical in this space. So what we're suggesting is that if people have no risk factors, as in they've got no allergies, so they're not at risk of anaphylaxis because you've done a great pre-screening on them, they're not people that normally you're worried about fainting, then to have a 5-minute observation period is fine. What we're not really recommending is for people to have the vaccination in their car. And the ones I saw on the news, I was just cringing because they were giving them the vaccination and then they were just driving off home. And I'm thinking, ooh, when you've been around as long as I have, we remember the man back in, I think it was about 2010, had his immunisation, waited for 15 minutes after his immunisation, then jumped in his car, drove home, had a syncope, crashed his car. And I think actually may have died, I'm not quite sure. But so we're really wary about letting people just drive home. So what they're saying is certainly have people wait in their cars, bring them in, give them their immunisation in the practice. By the time they get dressed, whatever, and they're all fine, after 5 minutes, then they go back, they can sit in their car, but don't drive off. And if they're going to sit in their car, they need to have someone with them, because what happens if they do have anaphylaxis or they faint? If they're sitting in their car by themselves, they're not going to be ringing you if they've just fainted, are they? So you need to make sure that you have got some of these protections in place. And naturally, if they do have a history of fainting, you're not going to do them in the car because you're not going to be able to lie them down. And the other thing is, we're seeing an increase in the shoulder-related vaccine injuries at the moment, and it's because people are not actually visualising the deltoid properly, and I would find it very difficult in a car to actually get the deltoid properly. So we can do it, but we need to do it sensibly and safely, and so not actually give the actual immunisation in the car. That's sort of flu in a nutshell. I know I've gone through that quite quickly, but I also know I've got limited time. So was there any questions on that? No? No one wants to try? All right, good. Okay, you know how we've just taken 20 years to get our head around pneumococcal and category A's and category B's, and when am I going to give Prevnar? When am I going to give Pneumovax? It's all changing as of the 1st of July. So I'm just going to go through this fairly quickly. If any of you have got this great little card, which was really helpful, get rid of it, because it's not going to be of any use after the 1st of July. Sorry, but we do have good resources coming up. Okay, so as of the 1st of July, anyone with an increased risk of pneumococcal disease is now going to be recommended to have an extra dose of Prevnar 13, the 13 valent, and 2 doses of Pneumovax 23, the 23 valent, in their lifetime. So what this is, it's still for people medically at risk. Aboriginal and Torres Strait Islander people at 50 years of age and over. And we're going to no longer give Pneumovax 23 to healthy adults. So that's just gone out altogether. So the new schedule is that people at the age of 70 will get a single dose, if they've got no comorbidities, of 13-valent pneumococcal vaccine. So they will get Prevnar 13 at the age of 70, and that's it. So the 65-year-old program has gone. Aboriginal and Torres Strait Islander people will get their 13-valent Prevnar at 50 years of age, and then 2 doses of 23-valent, the Pneumovax 23. So what we have at the moment is resources from the Commonwealth. Victoria is doing their own ones, but you actually have, and I don't know how clearly you can see this on the screen, but they've got this great clinical decision tree, and I actually think it's probably the clearest we've ever had pneumococcal given to us. So there is no change to the childhood program. So the childhood program remains the same. Healthy children get their Prevnar 13 at 2, 4 and 12 months. End of story, over and done with until they're 70, and then at 70, if it's still going, they will get Prevnar 13 again. If the children are at risk, so children under the age of 12 months at risk, it's the same as it is now. We get Prevnar 13 at 2, 4, 6 months for that extra dose, 12 months. Then at 4 years, they will then get their Pneumovax 23. And if they're medically at risk, then 5 years later, they will then get one more, at 4 years, they will get Pneumovax 23. Yes, that's right. And then 5 years later, they will get another Pneumovax 23. And once again, that's it then till they're 70. Then they will get something then. So it's going to make it just a little bit easier. We've got the same thing for your medically at risk patients, your Aboriginal Torres Strait Islanders, and then people that have no risk condition, just one Prevnar at 70 years. And then the other thing they've done to try and make life easy for us is they have tried to simplify who they actually call at risk. And so now we don't have category A's and category B's. They actually tell us who is eligible for this new program where they get an extra Prevnar or they get Pneumovax 23, and they even tell us if it's funded. Yay! So no more trying to work all of this out. So I think it is going to help us. Hopefully it will make life a little bit easier. So all of this is available on the health.gov.au website, so the Commonwealth website, but DHHS do say that they're bringing out some things as well. I'm not really sure when they're going to be available. One would hope before the 1st of July. So the big thing is, so you've got someone that's just turned 70 and they've had a Pneumovax 23. The big question is going to be, when can you give them the Prevnar 13? And what we're recommending is that you wait 12 months now. So you can have it 2 months later, but the recommendation is wait for 12 months between your doses of Prevnar 13 and in Pneumovax 23. Pneumovax, nothing's changed. We really don't give Pneumovax 23 before someone turns 4 years of age anyway, so that really isn't any change. We're just going to give 2 doses of Pneumovax 23 5 years apart. You don't have to work out if it's a category A, so they have 5 years and 5 years and 5 years, and category B, they have 10 years or 8 years or whatever. So it's just 2 doses, 5 years apart, done and dusted. If someone has already had 2 doses of already had 2 doses of Pneumovax 23, then those are counted. So if they've already had 2 doses, that's their 2 lifetime doses that they have, and they can just be given a Prevnar 13 if they haven't had that. It's fairly complex in the writing of all of these advices, but it is going to make life easier. So that's pneumococcal in a nutshell. So is there any questions on that one? Does anyone want to yell at me? Nope. All right, I'm going to keep going so you can all go and finish on time. So the other change on the 1st of July is meningococcal B. So Bexsero is going onto the NIP only for Aboriginal and Torres Strait Islander children, and they will receive that at 2, 4 and 12 months. If they have an additional risk factor, such as sickle cell disease or one of those things, they will get a 3rd dose, which will be given at 6 months. All Aboriginal Torres Strait Islander children aged under 2 years are eligible for a catch-up program of meningococcal B, which is really great. And meningococcal B and meningococcal ACWY vaccines will be funded for people with risk conditions, you know, asplenia, hyposplenia, having that drug that I can never pronounce, but so I use the generic name, which is Solaris, because I just can't pronounce the other one. So all of this is available on the fact sheet. So it means that all these people that have lost their spleens, that instead of having to pay for all of these things, are finally going to get it funded on the NIP, which is really nice. I think the big thing to remember for the Bexsero, that we're giving it in the age group for the Aboriginal Torres Strait Islander children, where they actually need to have prophylactic Panadol with their, or paracetamol, with their dose of Bexsero. So ideally, they have it 30 minutes prior to receiving the vaccine. If not, give it as close as possible to having the vaccination, and then 2 further doses are recommended after that. So we just know it's the fever profile on it, not acceptable to most people. So remember those things. This is just the National Immunisation Program has got all of this information in fact sheets. So there, I cannot believe, sorry, I'm being very cynical here, but, you know, considering the last change that we had on the schedule, the Commonwealth actually put out their fact sheets on the 29th of June, which was a Friday, for the changes that were going to happen on the 1st of July on the Monday. I'm really pleased to see that they've actually got all the information up there, giving us a lot of time to actually digest it, rather than trying to have it all done just over a weekend. So the Bexsero dosages are the same as in the handbook. So they get 3 doses of Bexsero if they're under 5 months. So as I said, they will get their first dose with their first vaccine, so they can have it as young as 6 weeks, their second dose at 4 months, and the 3rd dose at 12 months. What we're trying to do is make sure that for all of these things, such as meningococcal vaccine, Prevnar, you know, pneumococcal, that there is a dose given in the 2nd year of life, which starts at 12 months, because there is a better long-term protection. If we give all of these vaccines under the age of 12 months with no booster, then we don't get that long-term protection that we want. And so, yeah, it's just straight out of the handbook is how we're doing this. And you can use your handbook app that you're all going to download now, because you've seen on the digital health guidelines, that's what you're going to do. So there are other things that we just need to make sure that we're still aware of. We've still got to remember that we're giving MMR for people born after 1966 if they don't have their 2 documented doses. And also remember, like, I know there's no travel going on at the moment, but there are a lot of children out there that got their first dose of MMR prior to 11 months because they were traveling or there was something going on, and they actually need to have 3 doses. So they need to have their dose at 12 months and their dose at 18 months. So just make sure that we are giving those 3 doses of MMR for children that have received MMR prior to 11 months. We need to make sure that we're recording all our adult vaccination data on air. There was very poor NCIS, the National Centre for Immunisation Research and Surveillance, did a bit of an audit of AIR and found that there wasn't great record keeping for those 65-year-olds in their flu and their Pneumovax, and now their Prevnar 13. So it's really important that we do have this documented. DHHS, you know, their beautiful vaccine side effects sheets, those tear-off pads, which are so handy, they've been updated. So please make sure that you order the new ones. So the updated ones have now got meningococcal B on the front page for your Aboriginal Torres Strait Islander children. And then on the back page, under rare side effects, needing quick medical attention is a side effect of Zostavax. So if you have a patient that's had Zostavax vaccine and 3 to 4 weeks later they present with a fever, unwell, and or with a chickenpox-like rash, it is now considered to be a medical emergency, in that this is probably an immunocompromised person that has been given Zostavax vaccine that shouldn't have received it. So they haven't actually definitively said what they would like you to do with those patients, but I'm presuming it's the same as if you inadvertently gave it to a patient that was immunocompromised. You would ring your ID physician and get some advice on what's happened. We've had deaths from people having Zostavax vaccine, and we really do want to avoid that. It's why we highly recommend you use the GP decision aid if you are deciding whether to give Zostavax vaccine, and if in doubt, then contact a specialist before you give it. I think you all know that we've got the funded ACYW in the school program, and so that's for year 10 students. In primary care, we can give it to adolescents 15 to 19 years of age. What we have to make sure of and realise is that people are not going to have had their school-based programs because they haven't been at school. So it's, you're probably, if you're working in general practice, seeing adolescents that you're going to need to check up on what's happening. It's going to be really difficult, I think, for local government to try and catch up on these kids, especially those kids that maybe have decided that working from home is so much better than going to school, and they're going to continue doing it. So just something to keep in mind. I think this is nearly the end. It is, it's my last one. Just that DHHS said they were getting a number of errors notified to them, and we know that you don't have to notify errors to DHHS. You know, if there's an adverse event, you report it to SafeVic, but sometimes people do inadvertently give a vaccine, and you know, the wrong vaccine or at the wrong interval, and they'll ring DHHS for advice. So they just have been noting this down. And so I just wanted to just remind people that they do have a lot of fantastic resources on DHHS's website. So administration of the wrong vaccine, I know is really difficult to see, but they have a fact sheet which is on DTPA containing vaccines. The front page is all your Infinrix, Infinrix IPV, Infinrix Hexer. I mean, it's very easy to get those mixed up and at what time point you're giving them. And then on the back page, which you actually can't see on this presentation, is your adult DTPA containing vaccines. They also have something similar for your MMR, so your MMR and your MMRV vaccines, still getting people giving MMRV as the first vaccine in children under the age of 4, which we don't want people to do. And I think probably the biggest time that there is an error is when people are trying to do catch up. And so for children under the age of 10, use the South Australian Immunisation Calculator. It gives you the NIP vaccines only. So if you've got a child that's got medical conditions, it's not going to tell you what at-risk vaccines they need. You know, if they're Prem, it's not going to tell you to give the extra Hep B or the Prevnar. That's something that you need to work out, but at least it gives you an idea, and it's really worth playing with. For a number of years, people have always said, oh, you know, it doesn't work properly. It actually does. And I think it's a really great backup for people that have been working in immunisation forever. You can use it as a bit of a check, or if you're new to immunisation, even if you wanted to work out what you thought the child should have as a catch up and then use the calculator. It only gives you the antigens that are required. You still need to work out the vaccines. And so my poor students, anybody that's done my course, sorry, when I do catch up with them, they've suddenly got this list of antigens and they're just really confused about which Infinrix they need to use. So it's worth looking at. And then for the over 10 years, with the Victorian DHHS has an immunisation catch-up guidelines, which are available on their website. For a number of years, they were a well-hidden secret, but they now are available on the website. And one of the reasons for this is that people put stuff up on websites and then it's out of date. And I was just saying to Alicia, on my work computer today, rather than my home computer where I have everything bookmarked, I just put immunisation schedule Victoria. I just wanted to check something. I can't even remember what. And the first thing that came up was January 2019 schedule for immunisation in Victoria. That was the first thing on the Google search. And I'm thinking, this is not right. I'm wanting April 2020. So just be very wary when you are, especially if you download things, they go out of date very, very quickly. So always go back into your websites and check that you are working from the latest things. And that is everything in a nutshell. What I'm going to do is turn off my laser pointer again. Sorry. I'm just going to say thanks to all the people that actually, this is me. For those that don't know me, this is me in a nutshell. That old bag, you know, the old charge nurse that just wants to say, just do it. But I don't. I try and give people reasons why they do it. So what I'm going to do is pop into the chat now, because I think there is a few questions for me. So what I might do is stop sharing my screen, and then I can pop in and have a look and see what people are asking. Cool. Okay. So just was there anybody that has done the benchmark influenza course that Gippsland let you do, which is very nice of them? And were there any questions from that? Did anybody have anything that, I thought it was fairly straightforward? Mm-hmm. Okay. So the Spleen Australia regime, is it changing? It probably will change, and it also means that they will probably get funded vaccines, whoever's asked that question. It'll be a bit of a watch that space. I'm sure Penny Jones is right on to that. I don't think she will let this opportunity pass her by. So yes. Okay. Oh, great question. I am so glad whoever asked about giving the 4-year-olds at 3.5 years, because I had that in my presentation in my notes, and I always skim through things if you get to read my notes. And that was one of the questions I wanted to ask you. So the we used to recommend giving the 4-year-old DTPA containing vaccine, the Influenza IPV, I think it was at that stage only, at 3.5, because they had had their primary course at 2, 4, 6 months, and they had not had another DTPA containing vaccine until they got to 4. Now that we have brought back that 18-month DTPA containing vaccine, it's no longer recommended to give it at 3.5 unless they happen to be traveling overseas or doing something like that. We would prefer that you gave it at 4, because we have got that Influenza or that DTPA back at 18 months. So it's really interesting. We took it off 18 months. When I say we, royal we, not me personally, at 18 months, because we were getting that reaction where they're getting that big arm, and so they took it all off, and now they've put it back on again, and people are coping with the fact that their child can get quite a swollen arm because it's not painful, and it's better to have people protected from the whooping cough. So another great question. Oh, see, this is in my notes too. Thank you, Tanya. You can give Prevnar 13 and Zoster at 70 years of age together. It is in the handbook saying you can give it with both either Pneumovax 23 or Prevnar 13. It may have on the product information not to give it, but you know, in the handbook they have that separate little bit in each chapter that says ATAGI recommendations or something that differs from the product information, and so it's in that section, I think. So yes, so they can come in at 70, give it to them both. You know, some people will forget to come back if you space it out, so let's just get them all in at 70, give them their Prevnar 13 and their Zoster. Just also a reminder too that I can't believe that I'm saying this, but it's in nearly just over 12 months. So October 21, the Zoster catch-up program will be finishing. So it's probably a really good chance, while people are sort of coming in to get lots of vaccines, make sure that all your over 70s, but under 79 or under 80s have had their Zostavax vaccine, because it will not be available for catch-up after October next year. So there's that. Is there anything? Are there any other questions? Nothing else? Did I cover it all in record time? You can all go and have an extra glass of wine now. So. Nothing else? Okay. Oh, it's only 4 minutes over, so it's not too bad. Not too bad. I think that's probably it, Alicia.
I think so. Sorry, I just there we go. I'm back. I was like, my video won't turn on to say yes. So, Michelle, I'd like to thank you for coming this evening and presenting for us. It was a very informative session. I've learned a little bit as well. I did drop those 2 references, the ATAGI clinical advice and the decision tree. I've just dropped those into the chat. So you can pick them up from there and drag them onto your device. So you've got easy access for those. We have just got one quick last question here. When do we expect that change to come with regards to Spleen Australia? I
am presuming the 1st of July, but I can't guarantee that. So yes, that would be, I'd just be watching their website or maybe giving them a quick bell to make sure. As I said, I'm sure Penny's totally over it, but yes. And so, yeah.
No worries. All right, well, thank you everyone again, and we'll see you quite possibly in this format next time. Thanks again.
Thanks everyone.
Thank you.
Have a good evening.
Bye. Bye.